Hi everyone, my name is Alexander Auchus. I'm an undergraduate student at the University of Pennsylvania, and today I will be presenting on our work, Increasing PrEP Use in Cisgender Women Through Contextualization Within Sexual Wellness Services, a QI Intervention Pilot. So some background information. PrEP is 99% effective in preventing HIV transmission via sex. However, PrEP uptake among eligible cis women is particularly low across the US. Societal stigma associated with PrEP has been identified as a significant barrier to PrEP use among cis women, and social networks and normative contexts impact the likelihood of PrEP uptake among cisgender women. So for this quality improvement project, we developed a communication tool in the form of a narrative style video, and this 18-minute video contextualizes PrEP among other sexual health tools such as contraceptives, condoms, and STI testing. We also aimed to address social stigma associated with taking PrEP, and the intervention contains a visualized text message conversation between a feminine or female patient and a feminine or female provider as seen. So the provider explains that sexual history discussions are judgment-free and presents PrEP alongside familiar sexual health tools. And just to give you an idea of the content, here are some quotes from the video. Sexual health is an important part of your overall health. We are never going to tell you what to do. It's all about giving you the right options for your health. There are lots of tools to stay healthy, like STI testing, emergency birth control, and PrEP. So to help contextualize PrEP among these other familiar sexual health tools, the conversation is followed by a 14-minute slideshow that describes these sexual health tools. We assessed the feasibility of displaying this video in an urban primary care waiting room, and 79 patients viewed this video, 51 of which were assigned female sex at birth. 3 cisgender female patients, patients 1, 2, and 3, completed post-exposure prophylaxis, or PEP, during the video exposure period, but only patient 1, who is in a polyamorous relationship with a cisgender female partner, a male partner, and a transgender female partner, began PrEP use after PEP use. Patients 2 and 3 did not start PrEP after PEP, and no other cis woman began PrEP use during the exposure period. To conclude, an 18-minute video contextualizing PrEP was viewed by 51 female patients over a 17-day period, but only 1 of 3 cis women prescribed PEP elected to start PrEP during this period. No other cis women started PrEP during this period. Patient characteristics suggest the acceptability of PrEP may be higher for cisgender females whose social circles are common PrEP research and advocacy targets, and the findings emphasize the importance of normalizing PrEP as a sexual wellness tool that can be used by anyone. More research is needed to see if similar video interventions can impact long-term decisions to start PrEP in this population. Here are my references, and I'd like to thank my co-authors Lyndon Lally-Cherexko and Dr. Helen Koenig, and everybody at Philadelphia Fight for making this possible, and thanks to the event organizers as well. Thank you.